we have all of this information, we've built a lot of tech around it, but then we still are having issues with keeping people alive.
Right.
Why is that? So I think people started to really question the systems that are sort of in charge. How do I know that I can trust you as a system, you as a healthcare provider or operating inside of this healthcare system to take care of me or to take care of my loved one? But then you have a lot of folks that are coming in from med school and even practicing physicians now that are like, yeah, I've used technology like my whole life and like, it's good.
Right.
I'm excited about it. I want to use that. But if I can see more patients or if I can solve a really complex problem without spending 3 days in the literature, like, sweet.
Yeah.
So I think that we have to find our way through that.
Welcome to the Digital Healthcare Experience, brought to you by Taylor Healthcare. Subscribe now and stay on the forefront of the digital healthcare revolution.
Hello and welcome to the Digital Healthcare Experience podcast presented by Taylor Healthcare. I'm your host, Chris Civit-Therese, and today I'm joined by Dr. Lindsey Jarrett, Vice President of Ethical AI Services at the Center for Practical Bioethics. Dr. Jarrett holds a PhD from the University of Kansas, and she has extensive experience in program management, research, and executive consultation across nonprofit, academic, for-profit, and government sectors. As a social scientist, she has provided evidence-based interventions and practices to underserved communities. Her clinical research has improved decision-making in opioid safety, infection control, readmission prevention, maternal mortality, social determinants of health, and post-acute care. Welcome, Dr. Jarrett. It's great to have you on the show.
Thank you. It's great to be here.
All right. Can you start by telling us a little bit about your role at the Center for Practical Bioethics and what drew you to that organization, which is basically, as I understand it, kind of at the intersection of ethics, healthcare, and technology?
Yes, exactly. I joined the Center for Practical Bioethics in 2021, technically, but I actually started out in 2019 as a community volunteer. I was working at a large healthcare IT company at the time. That's where I was building the algorithms that you kind of spoke about in my bio. And I was really doing the work, like deep into the electronic health record, understanding patient outcomes, building clinical decision support tools for providers, for other types of healthcare staff, and really in the weeds with all that. Kind of started at a small team inside of that organization, and then it really grew as a lot of people really wanted to use data and to really use a lot of this information to improve health outcomes. And while I was kind of doing that work, I was really introduced to a lot of different types of questions that clients were kind of having, even other researchers and mathematicians and architects and engineers and all the people that are kind of responsible with working with the data sort of internally in an organization and externally. I really started to think about kind of those questions of like, how are we getting the data? Is the data good? Is it bad? How should I make a decision with this data? Which then kind of drew me to thinking about what are the other folks that are having this conversation. And we were really, I think at that time, back in 2018, 2019, we, I think as a society, were sort of having those questions, right? Like, how should we use technology? How can we? But what are the kind of considerations, which then had me stumble onto this local organization that's local to me. And the Center for Practical Bioethics is really, in its simplest form, an organization that responds to ethical issues in health and healthcare. So it's very broad. It's all the way in thinking about end-of-life decision-making, how a lot of people kind of think about bioethics, but then also they have a great opportunity to think broadly about all of the things that sort of happen in healthcare across all different types of spaces, not just in hospitals. And so there's sort of a perfect organization to sort of have some of these conversations and sort of live in that intersection of not just care delivery or how you're thinking about yourself as a provider or your community as providers, but also thinking about who are the people that are coming into health and healthcare, like technologists and other folks, and how we sort of have these ethical dilemmas and questions that a lot of people have in all different types of contexts. So I live in that space now. It's my bread and butter, and we get to use a lot of our frameworks that the center has done so well in the community over the last 40 years, but now sort of bring those into the technology space, which has been really fun.
I think that is fantastic and such great work. Obviously, anytime that we talk about AI, one of the natural sort of threads is going to be ethics. And I'm really excited for this episode because I think this is kind of the first time on this show that we've devoted an entire episode to the topic. And I know obviously over the last probably decade or so, we've seen this huge evolution from a data perspective as big data has sort of came into the picture and so on. And we've seen the shift, from population health to focuses on social determinants of health. So I'm curious, can you kind of lay the groundwork for where we started this journey and kind of where we are with this journey from your perspective?
Definitely from my perspective, I think a lot of different people that have been working in technology and then specifically in healthcare technology probably have different perspectives about when things started and grew and all of that jazz. But I think that really, I feel like I went into tech in a perfect time. I really went in 2015. I was straight out of my doctoral work, so excited to be a scientist. Everyone was talking about big data. I left a university setting where I was so comfortable in my small little sample sizes of families with children with autism. And I felt like I was doing great work, but honestly, as a social scientist, I didn't feel like I was doing enough, just really understanding all of the complexities and just all of the problems that I could solve. When I entered the space, people were starting to talk about population health. I think in 2015, we were starting to talk about how do we bring a bunch of data together. A lot of open kind of data was starting to really come together in ways that we could actually use it, like federal data, also just like a bunch of health data, not only domestically in the United States, but also ways that we might be able to get data outside of the United States. And then also at that same time, we had like a really big cultural shift in how we even use our devices as people. And I think that we had been reliant on computers and we even were going into the tablet space and things like that. But we were not using the technology in the way that we're using it today. And I think that there was a really big boom in that. So people started using watches, all different types of monitoring devices. We were able, as healthcare providers, they were able to send things home with people so they could monitor their care, which was a huge game changer for people with chronic conditions. And then also people were starting to use these devices in their own homes. They wanted their cars to have fancy things. They wanted their TVs to have all the fancy stuff. You wanted to be able to just talk into your remote, right? So I think there was like a huge boom in that between 2015 and 2017, which I think really paved the way in us really thinking about what does population health mean, right? So we were talking about the Internet of Things, right? Where we had all of these sort of clusters of data and information sort of coming together to understand one person, to understand a population, the environment, and everyone wanted to play in the sandbox. Right. And so then we started to see an uptick in analytics companies where you could sort of bring these things into dashboards. And I think that sort of with that, then we just sort of threw a bunch of data together, for better or for worse, right? We just wanted to throw all this stuff together and understand it and be able to make sense of it. So I think that boom sort of helped us to think about, okay, well, what do we want? Why do we want it? Does the context of the data matter? Can you actually track this person across all of these different things? Do we want to do that? During that time, I think we saw a huge boom. And I think that it stayed that way, I would argue, until the pandemic, right? Really, in 2020. So I think that the pendulum sort of got stuck over in that space for a while. And I think it benefited a lot of people and a lot of companies. And I think we still are sort of learning how to use all of this information.
Yeah, it's really interesting. And I mean, you mentioned that the pendulum kind of got stuck. And I guess as AI has kind of entered the mainstream, let's say, that pendulum maybe seems to be swinging back towards sort of using as much data as possible to help drive decisions. So I guess first, is that a fair kind of assessment in terms of what's driving it? And then that obviously brings up the next question in terms of what are the ethical concerns that you're seeing in that shift or that reshift, if you will?
Yeah, I think the pendulum sort of was in that space for a while. And I think a lot of people were doing work, especially in like the area of like clinical decision support tools. We started to create like a lot of even if you just think about them in sort of like logic type algorithms of like, if this, then that,
Right.
that actually helps to improve the accuracy of those just by having more information, which is huge when it comes to thinking about standards of care and those kinds of things in healthcare. But then also, I think that it helped us to understand different folks of people that maybe we didn't have that level of information before. I also think that people were really willing to sort of give that information because I think that they also were willing to give that information in their personal lives.
Right.
Which from a systems perspective, I think is very important, right? Is that trust piece that I think is important. And then also I think that because of we were really excited in that space, we built a lot of things, a lot of companies built that. But then when the pandemic happened, I think that we had this other sort of perspective that came in where it's like, we have all of this information. We've had all of this information for years now. We've built a lot of tech around it. We've incorporated it into a lot of different things, but then we still are having issues with keeping people alive.
Right.
Why is that? So I think people started to really question the systems that are sort of in charge of building these things. And then I think that it's interesting. I mean, I'm a social scientist, so I wear this hat very heavily, but I think it's also interesting that during that same time between 2020 and 2022, we also had a lot of trust issues with other social systems. So healthcare is not exempt from that, right? So we had a lot of questions about our policing. We had a lot of questions about our political system. And then we also had a lot of questions about our healthcare system. You know, like, are we going to be safer? Are we going to survive during this like really chaotic time in our history? So I think that that sort of brought the pendulum sort of back into the middle and maybe even to the other side of like, how do I know that I can trust you as a system, you know, you as a healthcare provider or operating inside of this healthcare system to take care of me or to take care of my loved one? Does all the data that you have, is that really keeping me alive? Is it getting me the next vaccine? All of these sort of questions started to come up. And I think that that's probably where I started to see a lot of the ethical sort of questions start to come in and sort of balloon out. And I think that it's because, you know, people started to think about, am I at risk? Like, who's caring about me? Who's going to take care of somebody that I love? How can I trust that I'm going to stay well? And I think especially because we saw significant sort of negative outcomes for certain populations.
Right.
Which then, right, we sort of had this promise with the big data of like, we're going to take all this information and we're going to really help, like social determinants of health started to come in, right? So we're going to really try to understand you and your environment and what you need. And so we can make these like really smart individual considerations. And then during the pandemic, it was like, yeah, but you know, like, are you? So I think some of those questions really helped us to start to think about bias, start to think about, well, if the person is biased, is the data biased?
Right.
How is this information used? Who got the information? Is my information private? What are they going to know about me? And so people started to sort of go back in that direction of like, I don't know if I want to put all of my information out there, right?
Yeah.
But then we were sort of in that phase, which I feel like it was a really sweet spot, like this 2 years, you know, when you look back on it, you know, being in 2025, you look back on it and you're like, man, that was such like a short, sweet spot, right? For us to have some learning. And I think some we did, but I think we also had an opportunity to think about like, okay, how do we sort of get back to the space of trust and information, trust and decision-making, where people sort of feel like, yes, I'm willing to get that information because I really want to figure out my rare disease, or I really want to figure out, you know, how to prevent my symptoms getting worse, or even I want to understand my symptoms, but I have to then trust to give my information. So I think trust is a really, really big piece. Then in 2022, you know, late 2022, ChatGPT came out and people were like, whoa, I can like put all this stuff in this thing and it'll like give me an answer and it'll make me feel good about it, which is like a whole nother episode of like, you know, agents and how these sort of tools, you know, do their thing. But I think that it's sort of interesting thinking about how we're bringing in sort of this information, but also you have to understand that people have to not only understand it, but also trust that you're going to make good decisions from it. And I think sometimes we assume trust, which I think is a really big ethical consideration when you think about these tools, because some people might be totally willing, like, make my home a smart home, make my car have all the things, and I want to drive, I want to get to the point where I just can hop in a car and get to where I need to go. I want my phone to know me. I want all of my content to know me. And people are completely willing to do that. And those are probably the same folks that stand first in line for the new phone. But there's a lot of other people there in sort of that middle space of like, I don't know. I don't know if I should. What does that mean for me? What does that mean for me in the future? Like, how are they going to use my information? Are they going to sell it? How do I benefit from it? Right. So there's just all these sort of questions that we still have yet to sort of answer from sort of a system or societal level. I think we're getting there with asking questions of the data, which is a great start. But I think we also have to ask questions about our decisions, not just the data that comes in and out.
And I mean, with that, I think that means that policies are going to be so important and sort of governance and frameworks to use as a guiding light. And I know you've done a whole lot of work with that across a number of different organizations. And I know you have a unique lens too in terms of working with providers all the way from executives down to end users. I'm curious if you can talk a little bit about the strategies that you've seen effective for getting buy-in across those different stakeholder levels, specifically when you're creating the policies and the frameworks that guide this.
Well, buy-in across these stakeholders is not easy.
Right.
I think that it's very dynamic. I think it's very multifaceted, right? I think that there's a lot of different interests, influence, power dynamics, all those sorts of things that exist. And I think they exist across like any social system. But in healthcare specifically, it's been really interesting because I think that healthcare often lives in this space where standards can either be very rigid, right? So there's very little room to wiggle or be flexible in sort of like your decisions. Or there's also like a lot of policies that are flexible depending on who's in charge. So I think that at one end that offers a space for people to have, those hard decisions. And then on the other end, sort of like if you don't have something in place, that could be really problematic for the system. So I think that that's like really important to think about. And probably healthcare is not unique in that, right? I think that we sort of use policies and standards in a way that suits us sometimes. That's an important consideration. But what I do think is that healthcare thrives in regulation. I think it's something that the actual system itself, and especially the way in which it was created in the United States, really wants to ensure that it's providing evidence-based medicine, that, you have people with certain types of credentials providing care, and there's certain types of touch points that are really important depending on who's doing what at any given time, how you treat patients, how you communicate to patients, right? All of that stuff. I think that healthcare loves regulation as a system. Maybe not every person in it, but I think that as a system, I think it really thrives in regulation, which I think is really challenging when you think about advancing technology in that same system, right? So if a system that sort of thrives in regulation also wants to be innovative, right, and wants to be current and up to date, some of those things those values, they sort of run in parallel, but don't have a lot of intersection, especially when you think about technology or digital health. So I think that you sort of have to constantly ask a question of what do we gain and what do we give up, with any sort of technology. And I think that when healthcare organizations can start to have those kinds of conversations, and not just, oh, this is going to save me money, or this is going to save me staff time or chart time, right? So a lot of physician burnout is usually a big part of a consideration when actually buying, a piece of technology. But I think that what I've seen with healthcare organizations is that I think it's very challenging, but I also think it's a great space where they live in this intersection of being a purchaser. So you're procuring these pieces of technology as a healthcare system, right? You're getting them for all different types of things, whether it's bed management, management, resource allocation, staffing, clinical decision support, patient safety, right? You're having all of these different kinds of things come in and out of your organization. So you get to be that purchaser, right? So you're a consumer. You have a consumer lens of what is this going to do for me? What is it not going to do for me? But then you also, a lot of healthcare organizations today have really great development teams.
Right.
They now have chief technology officers and chief data officers, and we've had a chief medical officer, chief nursing officer, and then we've created chief nursing information officers and chief, right? So we have people that have been trained to understand information and understand data, and then they build teams. And we've been doing that. I feel like we've been doing that actually for the last 10 years. So I think that you have this really great spot and opportunity to sort of think about what it can look like to buy something and build something. And what does that mean for your organization? So I think the organizations that I would say stay current with AI policies, given that we don't have a lot of regulation, a lot of these organizations have been really forced to think about these things themselves or to rely on associations to sort of help them in navigating this. And I think that one of the first things that they sort of think about is, how do I govern this, right? Governance structures are like alive and well in healthcare organizations in all different aspects, right? So not just the legal people, but thinking about what are the governance structures, what are the pipelines of decision making. And so I think what I've seen where I think people are trying to be successful in this space and to sort of think about ethical considerations, or to even just think about like, how do I understand how these tools are being used in our organization? And then how can I make sure that they're not harming people and they're actually helping people, even if they don't have very strict ethical parameters quite yet? I think organizations are still working on that. I think one of the first things that I think is successful and people have seen success is to bring people in across their organizations, like to really talk about the impact of AI, to talk about how we can educate, provide awareness. You know, this idea of AI literacy is sort of growing, and people are starting to think about that. What does that mean? I've seen it most successful when people bring not just their C-suite in, right? But really think about what are the other leaders that really need to be a part of this conversation, and how do we start to think about this? Not just the data people, not just the providers, you know, what are some other folks that need to be a part of this? And even bringing in like community engagement type teams. There's a lot of those, right? Patient satisfaction teams. I mean, there's a lot of people that are really on the front lines with patients. So usually when you are able to start that conversation and you've made it a priority, a governance structure comes very naturally out of that, which is great, right? Because people look around the table and they think, okay, well, you can help me solve that problem. And then I can bring this and you can bring that. And okay, we're going to meet together every month and we're going to create something from it, right? So that's a very natural next step, is when you start to convene people and people can kind of share their concerns in a safe space and sort of think about what are the things that we value about AI and how we can sort of bring that forward in our organization and not be terrified by it, right? Because fear does drive a lot of things. And then I think the other things that I've seen are really finding like multiple ways to be transparent about AI. So sort of like adding on to what I just said about what are the good and the bad? What are the things that we sort of need to consider? And maybe good and bad isn't the right word, but I think it's a natural sort of way that our mind thinks about it. Like, oh, I could definitely benefit from that, you know, or, oh, I don't know, that really makes me nervous. I don't want that. And so really being able to have that conversation. And I think it's really hard. I mean, transparency is very hard, especially when you have a business, because I think it's also really hard when you're like, if part of your transparency is we're figuring it out, we're going to take the next 6 months and we're going to create policy and we want your input and we're going to provide education and we're going to provide people coming in and having conversations. Like, some people are like, do you even know what you're doing? Right. So you have this, like, you have this perception that like, well, if we're really transparent and we don't have everything figured out yet, then is that going to be a risk? Right. But I argue that I think it's a really, really important pillar to gain trust. We're all figuring it out. We're all trying it on. And I think it's important for organizations to be transparent about that. The last thing that I kind of see is when organizations sort of develop a system for like staff and patients, you know, to sort of build that awareness around AI, but then also be able to take action. So I think that's an important piece of it, is just like, you can't just put out something on a billboard. You can't just have a document that's in departments, but how are you sort of bringing in people to understand how do they mitigate risk? Like, what are the different checkpoints? How can they ask questions? How can they understand this tool? Who's responsible for it? And then, really understanding that. And honestly, I think when I first started this work, I don't think I understood how important and awesome risk management teams are in healthcare. I think sometimes they sort of get like in the middle of legal, or they're maybe like inside of that conversation or that thought process of legal. But risk managers are like wonderful at creating like standards of really understanding complexity and contextual considerations and thinking about how you're sort of creating a system for thinking about AI and acting on AI, whether it's great or whether it's preventing harm or, whatever it might be, whatever that system sort of entails. Risk managers might be some great people to bring to the table. So I've sort of seen that as a good sort of tangible success as well.
Yeah, I think that's such a great observation. And I mean, what's so fascinating to me is that these policies, these frameworks, they need to be, robust enough to be able to handle sort of all of these different facets, while at the same time, it seems like not being too broad so that they kind of don't mean anything to anybody. And I'm really curious, as you sort of navigate these organizations that you work with, knowing full well that we're still very much in sort of the evolutionary state of all of this, is there a snapshot of what a really good policy looks like in this space that you've encountered that you could share?
I mean, there's a couple. I think there's some organizations that are really trying to pull some things together and make them as simple, but yet complex enough where people sort of understand a clear beginning, middle, and end of a policy, which I think is very important in policy development. If policies can't be created into procedures, you need to go back and rewrite them, in my opinion. One of the things that I think that organizations are really thinking about and starting to implement, and this is something that we've helped some organizations do as well, is to think about what type of guidance could you have in your procurement process. So knowing that you're a purchaser, knowing that some of these teams are getting sales pitches all the time, they're going to conferences, like they're trying to understand all these tools because healthcare is also trying to be innovative, right? They want to find all of the great tools. They want to really improve patient outcomes. And so they're constantly on the hunt, but then also being sought out as a partner. And so how do you start to think about some of these ethical considerations? You also can think about this as an insert. So sort of alongside all of the things that you're already asking about in regards to patient safety, in regards to cybersecurity, data integrity. So you're already kind of looking at where is this data from? What are the things in it? What can you tell me? And unfortunately, a lot of healthcare IT companies are still able to be proprietary in that information, but you can capture enough information to know like, yeah, that particular feature is important because our department uses that or understands that, or our provider, wants to know more about that. So I think that you can get enough information to sort of understand that process. So having those kinds of questions when it comes to bias, when it comes to understanding what data has been used, what's your population that you used, being able to really ask those questions. And I think that actually having folks like chief technology officers and chief data officers even sort of embedded in your information services and then also in your IT departments can really help with sort of bringing that forward. And then if you have a governance structure, like that also works really well. Yeah. And then I think the other policy is one of the things that is an important next step after you sort of like build this awareness or education, start to have these conversations about impact, bring your leaders together to have these conversations. I think it's important to have a value statement. How does AI connect to the values of your organization? You already have a mission, you already have values, you already have usually core principles, those kinds of things embedded into your healthcare organization, whether you're small or extremely large. So thinking about technology and being able to connect it to those values, I think is also a really good document, even if you don't call it a policy quite yet. But if it's a good document for you to be able to track, yes, this is why we use AI, because we are trying to fulfill on this, right? So this is our purpose, and AI will help us to get there. But then also saying, we value improving health outcomes, and you can connect it to that, right? But then if you might say we value patient safety, and then how are you going to monitor AI to ensure that you keep your patients safe, right? So those are like really, I think, tangible connectors that you can make without creating a whole new value set of technology, because technology will move a million times faster than you, and you won't be able to keep up.
Right.
But if you can really connect it to technology, and I argue this a lot, that I think we actually should have done this exercise before we even started using the devices that we have in healthcare today. So to me, a lot of this work isn't new work. You've had conversations about, when should I use a device? How do I educate my students on how to use devices? What if a device doesn't work? What if it hurts someone? What happens, right? So it's the same kinds of questions, but now you're looking at something probably a little bit more sophisticated, and also looking at things that are connecting a lot of these pieces, where before I think you could have a monitor and it would be a monitor, and that would be it. And you could unplug it and it would stop working.
Right.
But these are a lot more complex considerations. But I think the sort of introductory questions and the introductory policy documentation and procedural documentation can start from that place.
So it's a real balancing act in terms of the technology and the innovation, the risk management piece of this that you alluded to, and then the patient safety aspect of this. So there's, these, I'll say, sort of intersections, maybe competing interests, maybe in certain instances. Where do provider organizations typically struggle with finding the balance of those elements and maybe more?
Yeah, I think that provider organizations really sort of struggle to see sort of the benefit in walking some of these things back. And by walking back, I mean like really sort of slowing down and looking at what are the types of technology that you have, what do they do, how do you track them today, who's responsible, is accountable, like kind of doing an inventory, which I think is a really big recommendation. I think a lot of other like scholars and technologists are really advocating for any organization to sort of do this, because like we talked about earlier, a lot of these organizations are like, yes, gimme, right? So we're getting all of these tools, and we've been doing it for like a decade, bringing all these things in. All different types of companies are in and out. And so I think that taking the time to sort of do that, and I think that that's a challenge, right? Anything where you're like, I need you to take time to do that.
Absolutely.
That's a challenge.
That's right.
So I get that, right, from a systems perspective. But I think we also have hired a lot of people along the way that I think can help with that. So if I was back in 2015 asking a chief medical officer to do this, I would be laughed at. I mean, rightfully so.
Right.
But I think that thinking about all the different folks that can do this, but also thinking about maybe we just have to start asking questions of the vendors, so we can also have this, and we don't have to take on that debt ourselves and sort of understanding these. So I think it has to happen sort of in both directions. I think we're also in this really interesting space, and I think this is a struggle if you think about sort of the care delivery space of healthcare. And I think we're in this interesting time where we're living in this old guard, new guard transition. So I think we have a lot of healthcare providers and administrators that are nervous about technology. I mean, they're not all, I wouldn't say 100%, but there's a lot of folks that are like, I've done it this way for 20 years. I don't need this thing telling me, I don't want this robot doing my job, right? So I think there's like a lot of that sort of mentality, which, I mean, that's fine. You have experience, you have your perspective, and you have probably had a lot of success, right? So no one's questioning that. But then you have a lot of folks that are coming in from med school and even practicing physicians now that are like, yeah, I've used technology like my whole life, and like, it's good.
Right.
I'm excited about it. I want to use that. And it's not because I'm dumb. It's not because I can't do my job. But if I can see more patients, or if I can solve a really complex problem without spending 3 days in the literature, like, sweet.
Yeah.
So I think that like that conflict is a very important challenge, because I think that we have to find our way through that. We either have to have well, I think I have a lot of opinions about what we could do, but I think that it's a very significant challenge that I'm not sure we're considering, because I think that you want people to be excited about innovation in medicine, and that's where we're at with it. I think a lot of people that are going into medicine are excited about innovation in all different types of ways. But if they come into a system that is not excited about that, or is scared about that, or their ability to use innovation in medicine is limited, that could be really problematic and actually slow us down even more. So I think that we have to sort of find a balance of like, what could we do with what should we do? I mean, we still have to do that right. Like, I mean, there are some people where I'm like, yeah, I know you're excited about that, but like, hold on. So that's important. But then we just can't have the extremes on one end of the other. We have to find a good middle space. But I think that's a really big challenge for the healthcare industry as a whole.
Yeah, I think that's a great observation. And obviously, we've talked a lot about what some of those challenges are and so on in this discussion. I'm really curious about, what are you most hopeful for when it comes to the future of AI in healthcare and ethical AI in healthcare? What are you hopeful for there?
Yeah, I'm hopeful for a lot of things. I'm pro technology. Yep. Some people think I'm like the technology police, by sort of sitting in this ethics space. I don't feel that way at all. Right. I use technology. I probably don't use it as much as my other, 40-year-old peers, but I'm excited for a lot of the things that actually can help to create independence for people. So I come from the disability space. I came in as a clinical researcher from the disability space. So I have a lot of perspective and experience with folks that use technology as a way to live a lot of aspects of their life. Right. And I also have a father with Parkinson's disease, and his symptoms will just get worse. It's a part of his disease. And so I want him to be able to be in a car for as long as possible. I want him to be able to get his medications in a way that, if he can go on an app and they can get his information and then send him medications securely and safely and in an organized way that he can get to them. He already uses technology for a lot of things, but I think if we can continue to do that. I love voice assist technology. I love telemedicine. I was so excited about all of those things coming out. And I think in some aspects, we've sort of lost a little bit of that light, but I want us to keep moving forward with that. I like the idea of those types of technologies. It's a game changer for people. I mean, when people could start to order food to their house in an app during the pandemic, I mean, we're probably never going to take any of those apps away. Right. I mean, there were some that sort of like died, right? Like after, and they were like, oh, we don't need these anymore. But those, no, I think people really enjoy the fact that they can do that and they can order just about anything to their house, right? So that level of automation and decision-making and support, I'm excited about that type of technology. I think it will help people to do a lot more that we just don't have human capacity for.
Absolutely.
The other thing that I'm excited about too is I donated my kidney in 2021 to someone. Wow. And yeah, it was great. He's doing great. I'm doing great. Everything's great.
Great to hear.
Yeah, thanks. But also, there aren't a lot of living donors.
Right.
And that's really problematic for people that need transplants. I love the idea of thinking about technology when it comes to the whole field of transplant. So I think about, not only from a procedural standpoint, from a testing standpoint, I mean, all of the things in which we can use technology, but also thinking about what we can create. I mean, we had a big hype moment of 3D imaging, yes. But I think that thinking about that type of technology in the space of organs and procurement and I mean, just all of it, but also like ensuring, I mean, you can think about resource allocation. I mean, there's a lot of opportunity in just that particular context. So I think those are probably like my biggest sort of hopes for technology. I mean, also there's a lot of hope with rare disease. Right. I mean, people have really been struggling to understand what they have based on their symptoms. Then once they determine what they have, what do they do about it? How do they survive and thrive? How do they understand their life and what they should do? But then also, how do they create community around people with rare? I mean, there's just a lot of really great opportunity in that space. And I think that's actually really growing. I mean, I think genomics in general was a space that a lot of people are excited about AI, but there's a lot of ethical concerns about that too. But I think that for some people, it's really, really challenging to not have technology support in that space. And technology could offer a lot of things there too. So I think there's a lot of, I could keep going, but I think that there's just a lot of really great opportunity, but it's also considering that we're using it sort of in that context and not trying to use it in one space and then use that learning as a template for something else. Sometimes we love to do that in tech.
Right.
We love to be like, oh, well, it worked over here. Like, let's just bring it over here. Well, that's not always the case. So I think that a lot of researchers and technologists and AI ethicists, which is kind of wild to like have that as a field now, but a lot of folks that are in that space really argue to continue to stay contextual,
right?
Like continue to really think about how these tools can be used in specific contexts. It's sort of like bringing that pendulum back, right? To sort of like, yes, big data, large levels of information, thick data, sort of qualitative and observational plus quantitative data, like all of that's great. Like, let's keep doing it, but let's try to solve problems in a contextual way, right? Let's try to monitor in a contextual way. So I think that's definitely a space that we can continue growing. And I do have a lot of hope.
And it's really exciting. And I know we're almost out of time here, but as we wrap up, is there anything else that you want to share with the community? Anything that you're excited about? Anything at all to wrap up here?
Yeah, I think that one thing that I'll share is just to have people to just stay aware, just to really take time to sort of understand the tools that you're using, really sort of ask that question that I kind of posed at the beginning. How does it benefit you, or what do you gain, from using that technology? And then also like, what's the risk of it? What are the ways in which it could harm you? And just really start to like sort of create that sort of critical thinking of yourself. Sometimes we don't always do that. Sometimes we give it to the automation and we're excited about all of it. But if we can start to sort of ask those questions, then I think that we can start to really think critically of these algorithms, and then also use AI in a way that really works for us, and that helps us more than it hurts us.
Yeah, it makes perfect sense. And I think that's a great sort of overarching guiding principle. This was such a wonderful conversation. Thank you so much for joining us today, Dr. Jarrett.
Yes, thank you. It's my pleasure.
And thank you also to our listeners. If you enjoyed the conversation, please like, share, and subscribe to help us keep growing the show. And if you'd like to learn a little bit more about Taylor Healthcare and the digital healthcare experience, you can go to taylor.com/digital-healthcare. That's our show for today. And until next time, I'm Chris Vittorese, wishing you health, good cheer. Take care.
To learn more about Taylor Healthcare, please visit taylor.com/digital-healthcare. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services. The Digital Healthcare Experience is produced by Naomi Schwimmer. Podcast music by Nicholas Bach.
The more engaged the patient, the better the outcome. But how do you help patients get engaged? Introducing iMed Health from Taylor Healthcare, digital tools that increase patient engagement at every touchpoint. Go to imedhealth.com to learn more. Find the link in the show notes.